The evolution of the Cardiac Care Associate (CCA) membership has been a dynamic journey. Introduced in 2003, it was conceived by a handful of insightful nurses, physician assistants, and doctors who understood the importance of including a team-based approach to medicine, not just at bedside, but also in one of the leading cardiovascular organizations, the American College of Cardiology.
The educational foundation of the college is tremendous. It's really the gold standard for all of us. It's evidence-based, it's on the cutting edge with all the new science as well. And from that, I've grown significantly as a clinician because of my involvement in not just the college, but also teaching, which the college has afforded me to do.
I'm so delighted that I've been part of the Nursing Education Committee for the college. I became a member of the Nurse Education Committee through my work with CardioSource, and then have had recently the pleasure of chairing the Nurse Education Committee. And this hard-working group of nurses, nurse practitioners, physician assistants, and pharmacists do some very important work in helping the college really oversee all of the educational programs for our CCA group.
I'm involved in the core curriculum for cardiovascular clinicians, and it's really designed to provide sort of an A to Z cardiovascular education in preparation for nurses, advanced practice nurses, physician assistants, and nurse practitioners prior to getting into a cardiology practice. I've been very fortunate as a nurse member to be involved in several different committees at the college, both the educational committee, nurse education group, and some guideline writing groups, which have really been a great thing for my practice and a nice contribution for the college and to the college.
Education does not just involve nurses and their patients. CCA members also educate the nation's policymakers, serving as a principal voice on pertinent cardiovascular issues.
I have been, for the last 4 years, able to attend patient advocacy conferences that are held in Washington, D.C. We actually go to Capitol Hill and have appointments with our individual senators, legislators, congressmen, and bring to them the issues for consideration that we think will improve patient care.
The CCA's collaborative approach to medicine and their ability to interact with patients serve as core strengths to their organization.
Well, I've always believed that to care for a cardiovascular patient, it takes a village, because there's usually not just one problem that we're facing, and certainly a lot of it has to do with a lifelong adaptation to modifying the risks as patients go forward.
The cardiovascular team, again, is key to our future in cardiovascular medicine. Through the college, I've had opportunities to provide insight, perspective from practice, and educational sharing of my experience, as well as learn from others, and often present an educational program side by side with some of my physician and nursing colleagues.
You know, I think the approach of the college to have a team-based approach is just right on the money. That's where cardiology care is at this point. Nobody can take care of a patient by themselves, and to be able to pull in everybody and be seen as equal members taking care of the patient has been, to me, very rewarding to have in a professional organization.
Team-based care isn't just something that's nice to do. Team-based care is an absolute necessity. We're going to have more and more patients coming to us for cardiovascular care, and we're going to have an increased focus on prevention and disease management. And those are two areas where nurses absolutely excel.
Today, the American College of Cardiology includes over 4,200 CCA members. Together, they provide a collaborative expertise that improves patient focus in arenas such as cardiovascular education, science and quality guidelines, advocacy, and data registries.